All right, good morning, everyone. A very happy new year. I welcome you all in Homeo Insights 2026, a series in collaboration with LR Shah Homeopathic Medical College, Gujarat, hosted by Homeopathy 360. Today's webinar focuses on an extremely relevant and commonly encountered clinical condition, rhinitis, which significantly impacts patients' quality of life. While individualized homeopathic prescribing remains the cornerstone of practice, the root of administration is an evolving area that deserves deeper exploration. I am Dr. Nouri Ali, Senior Administrator at VJAN. It is my privilege to introduce our esteemed speaker, Dr. Nirav Ganatra, currently serving as Assistant Professor as well as Research Coordinator at the Department of Organon of Medicine, LR Shah Homeopathic Medical College, and NABH Coordinator at Gujarat. Dr. Ganatra has presented numerous papers at national and international seminars. He has multiple peer-reviewed and indexed publications and serves as a reviewer for UGC-approved journals and has contributed in our journal, The Homeopathic Heritage, as well. Today, Dr. Ganatra will present on enhancing rhinitis treatment, evaluating administration of individualized homeopathic medicines through oral versus olfactory routes, drawing from a comparative, randomized, prospective, single-blinded interventional study highlighting the scientific rationale, methodology, outcomes, and practical clinical implications of different routes of administration in rhinitis management. Let us warmly welcome our esteemed speaker of the day, Dr. Nirav Ganatra. Sir, we welcome you on Homeopathy 360.
Thank you, ma'am. Before starting my session, I would like to thank Dr. Vaidehi Bhatt, ma'am, who was coordinating with Dr. Nuri, ma'am, for regarding organizing all the webinars. I also heartily thank our principal, sir, our secretary, Dr. Arvind Bhatt, sir, for always motivating and inspiring us for taking participation in this type of seminars and webinars. I also heartily thank to Homeopathy 360 and Dr. Noori ma'am for coordinating such a wonderful way so that each and every speaker's every availability and everything is being taken care of for arranging the webinar and sharing the homeopathic insights on this wonderful platform of Homeopathy 360. So now
Pleasure
moving
is,
on to,
yes,
thank you,
pleasure
ma'am.
is all ours, sir. And sir will begin the presentation. A quick note for the audience: if you have any questions, ask, and we'll try to take them at the end of the session. Sir, the stage is all yours.
Thank you, ma'am. So, topic of my presentation that is comparative study to assess the effectiveness of administration of homeopathic medicines through oral versus olfactory route in allergic rhinitis. We have almost being encountered with the allergic rhinitis due to change in the season or because of the attack of some allergens like pollens and all, dust, which is the polluting agent which we have seen in various aspects. So, allergic rhinitis is a condition where we are being very much disturbed with all the things. In that particular aspect, we always try to have some kind of nasal decongestants, which would be helpful to quickly relieve our allergic rhinitis. And in homeopathic aspect, we are having very less number of awareness about how can we administer all the medicines through olfactory route, or how the nasal sprays which are available in the market can be a homeopathic nasal sprays also or not. So this study was aimed to uh, bring about the awareness about how homeopathic medicines are helpful or more helpful through olfactory route or oral route. The specific condition which I have taken first of all, that was the allergic rhinitis. It can be taken for various other aspects also. Rhinitis, which is characterized by inflammation of the nasal mucosa, presents a significant health concern worldwide, affecting the individuals of all ages. This condition encompasses various etiologies, including allergic, non allergic, infectious, and vasomotor triggers also. Ultimately, all of these are leading to nasal congestion, rhinorrhea, sneezing, and nasal itching. Rhinitis not only impairs quality of life but also imposes substantial economic burdens due to healthcare expenditures and productivity losses. Just for an example, if any of the personnel is correlated with any of the quality work, like quality checkup with in the engineering aspect or with the in the laboratory purposes, where a totally can say the environment is to be maintained which cannot bear any kind of infectious, non-infectious environment should be there. And in that condition, if the main person or the key handler is suffering from the rhinitis, it would be making a loss in its productivity. And healthcare expenditure in treating this rhinitis has been a lot by nasal for we'll be seeing the conventional treatment also where we have been looking about the nasal congestants, decongestants, and most of the times steroids have been administered through nasal route, which is ultimately handling the rhinitis. If we see to the statistics, according to World Health Organization report, the global burden of chronic rhinitis was estimated to be 400 million, and prevalence among the adult was ranging about between 10% and 32% in Asia Pacific region. Prevalence of rhinitis and other allergic disease has increased globally in the last 3 decades. If we see at the global level, 10 to 40% of the world's population suffers from rhinitis, with allergic rhinitis being the most common form. ISAC, that is the International Study of Asthma and Allergies in Childhood, reported that allergic rhinitis affects between 10 to 30% of children and 20 to 30% of the adults globally. Prevalence of non-allergic rhinitis varies widely, but it is less common than allergic rhinitis, affecting an estimated 5 to 10% of the global population. At national level, if we see, the Indian Council of Medical Research has shown that rhinitis affects 20 to 25% of the adults and up to 40% of the children in India. 11 to 30%, depending upon the region and population studied, allergic rhinitis has been seen. Non-allergic rhinitis is also common in India because, especially in the areas with the high levels of pollution and industrial exposure. If we see the differences between the urban and rural aspect, urban areas, especially in cities like Delhi, Mumbai, and Bangalore, this show the higher prevalence rates of rhinitis due to increased exposure to pollutants and allergens. Rural populations, while exposed to fewer pollutants, are also affected due to exposure to indoor allergens such as dust mites and molds, as well as the seasonal pollens in agricultural areas. Particularly talking about our Gujarat state. Specific state-wise data on rhinitis in Gujarat is limited. General trends suggest that the prevalence in Gujarat mirrors national averages, affecting about 20 to 30 percentage. Studies conducted in Ahmedabad and Surat have reported a significant prevalence of allergic rhinitis due to high levels of industrial and vehicular pollution. Rural areas of Gujarat may experience lower levels of allergic rhinitis compared to urban, but are still affected due to seasonal variations and in pollen levels and exposure to indoor allergens. Seasonality, Gujarat experienced seasonal peaks in rhinitis symptoms, particularly during the post-monsoon period, due to increased mold and dust mite populations, and the spring season due to pollen from trees and grass. Conventional management, as we already talked about, has the strategies for rhinitis, which involve pharmacotherapy, including antihistamines, intranasal corticosteroids, decongestants, and immunotherapy. While these treatments provide symptomatic relief, they are often associated with adverse effects and may not address the underlying cause effectively. Consequently, there is growing interest in complementary and alternative therapies such as homeopathy, which offer individualized and holistic approaches to the health restoration. Until now, we were the adjuvant therapy. We were considered as the adjuvant therapy providers, but at present, we are the forerunners, forefront foot runners in management of the allergic rhinitis because in many of the cases, there has been seen that allergic rhinitis or particularly rhinitis when treated once has been got managed for one time, but frequent recurrence has been seen on and off. Homeopathy, founded on the principles of similia similibus curantur, this like cures like, and potentization, utilizes highly diluted substances derived from natural sources to stimulate the body's innate healing mechanisms. Despite its widespread use and anecdotal evidence supporting its efficacy, homeopathy's scientific validation remains a subject to concerning the mode of administration. Two prominent routes of homeopathic medicines administration, that is oral and olfactory, have garnered attention for their potential in managing the rhinitis. We know about various routes of administration of medicine which we would be coming across, like parenteral route of administration, intradermal, intravenous. All these kinds of administration of routes of medicines are available, but oral and olfactory route out of all of them are being prominent routes of administration of homeopathic medicines. Oral administration involves the ingestion of medicated globules or liquid solutions, while olfactory administration entails exposure to remedies aroma through inhalers or ambient diffusion. Advocates suggest that olfactory administration bypasses the digestive system, facilitating rapid absorption and potentially enhancing the therapeutic effects. Risk factors regarding allergic rhinitis, if we see, are urbanization, as Rajkot has developed, or our nation is also being moving towards from developing country to developed nation in a more industrialized way. Air pollution from factories, vehicles, and construction activities is a major contributor to the high prevalence of rhinitis. An increase in rhinitis cases during the spring and post-monsoon periods due to the high rise in the pollen and dust levels. Occupational exposure, many industrial exposure workers to industrial pollutants and irritants contributing the case of occupational rhinitis, like in the case of mining and all. Climate and environmental factors also play an important role. Dry and dusty environment, airborne dust, which aggravates rhinitis symptoms in many of the residents. Agricultural pollen, the surrounding agricultural activities also contribute to seasonal spikes in allergic rhinitis, especially during the harvest and planting seasons when pollen levels are highest. If we look toward the general pathophysiology of the rhinitis, it involves a combination of immune responses, neural reflexes, vascular changes. Allergic rhinitis, an IgE, immunoglobulin E mediated immune response, drives the inflammation, while in non-allergic rhinitis, non-immune factors like environmental triggers or neural dysfunction play a key role. The pathophysiology varies depending upon the type, but in general, it involves the inflammation of the nasal mucosa, may it be allergic or non-allergic. The underlying mechanism involve a combination of immune responses, neural reflexes, and the vascular changes. Vascular changes in the nose, where nasal decongestions or decongestants are being used. Key players in rhinitis pathophysiology are, we can consider about the nasal mucosa, which is composed of layer of epithelial cells, submucosa with blood vessels, glands, and immune cells such as mast cells, macrophages, and eosinophils. This is the primary site of inflammation in rhinitis. Nasal blood vessels, these vessels dilate in response to the inflammation, causing nasal congestion. Immune cells, mast cells, eosinophils, basophils, neutrophils, and T cells play critical roles in mediating the inflammatory response. Sensory nerve endings in the nose, particularly involving the vagus nerve, contribute to the symptoms like sneezing, rhinorrhea, runny nose, and itching. Coming back over to the roots of the administration of homeopathic medicines, we are going to discuss about what our masters, our stalwarts have about the utility or the use of administration of homeopathic medicines through oral and through olfactory route. We would be looking about how beneficial would be to administer homeopathic medicine with the help of olfactory route. We'll be seeing in general about both the routes and then we'll be moving about to the organon point of view. The oral route is the most common method of administering homeopathic remedies. It involves the placing the remedy in the mouth where it is absorbed through the mucous membranes and then into the bloodstream. Various forms of medications are available for administering it through the oral route that includes pellets, globules. These are the small sugar based globules impregnated with the homeopathic remedy and they dissolve quickly in the mouth, allowing for the fast absorption. Liquids, homeopathic tinctures or dilutions can be taken in the drop form also, often diluted in the water for easier ingestion. Tablets, similar to the pellets but compressed into a tablet form. Mechanism of action, if we see, the remedy is absorbed through the oral mucosa, allowing it to enter the systemic circulation. This method is believed to stimulate the body's vital force and promote healing. Considerations, if we see, patients are more feasible and we can say advised to avoid food and drinks and strong flavors for a short time before and after taking the remedy to ensure optimal absorption. Next is the olfactory route. The olfactory route involves the inhalation of potentized medicines, typically through the nasal passages. And this will be in the form of either inhalers, that is, the devices that deliver a fine mist or vapor of the remedy, medicated oils. These can be applied to a cloth or directly inhaled their aroma, nasal sprays. These deliver the remedy directly into the nasal cavity. Most important aspect comes here is the mechanism of the action when the medicine is administered through olfactory route. The olfactory nerve responsible for the sense of the smell provide a direct pathway to the brain and the limbic system, which is involved in regulating emotions and autonomic functions. This route may allow for localized effects on nasal mucosa and respiratory system. Indications of the olfactory route particularly beneficial for conditions affecting the nasal passages such as rhinitis or sinusitis. The olfactory system is responsible for sense of smell and includes the olfactory bulb, olfactory epithelium located in the nasal cavity. When substances are inhaled, the volatile components interact with the olfactory receptors, leading to the sensory signals that are transmitted to the brain. The olfactory nerve, that is our cranial nerve 1, has direct connection with the limbic system, an area of brain involved in emotions, behavior, and autonomic functions. Direct pathway providing the olfactory route allows remedies to bypass the digestive system, which may degrade substances before they can exert their effects. Absorption through the olfactory mucosa provides a rapid entry into the bloodstream and the central nervous system, potentially leading to the quicker therapeutic action. Clinical application. The olfactory route is particularly beneficial for many of the respiratory conditions, such as rhinitis, whether it may be allergic or non allergic or infectious. The direct administration to the nasal passages provide localized relief of symptoms such as congestion, sneezing, and runny nose. Sinusitis, inhalation can help reduce inflammation and promote the of the sinuses. Asthma, some remedies can alleviate the asthma symptoms by acting directly on the respiratory pathways. I have seen in lots of asthma cases when the homeopathic remedies administered through olfactory route, it quickly deplasmolyzes, or we can say the spasms which are present into the respiratory muscles are quickly being silent with the help of administering the remedies through nasal route or olfactory route. Any kind of upper respiratory infection, the olfactory route can help reduce the symptoms like nasal congestion and promote the quicker recovery. Benefits of the olfactory route. The earlier we saw that how or what are the clinical applications. Here we talked about only the respiratory conditions, but in the many of the aspects such as migraine, one of the case which I have already seen in past week itself, when the patient was having acute attack of the migraine, the patient was told to take a sniff from the medicinal bottle, and within 2 to 5 minutes, the patient was totally all right. When the patient came and was sitting into the waiting room, he was continuously sitting with his head down, holded with whole both the hands, and a single, we can say, the noise was aggravating it, and continuously the light was also affecting to that particular patient. But after the administration of medicine through this olfactory route, within 2 to 3 minutes, all these kind of the venetions which were there, the vexation which patient was feeling due to all these tests, we can say this stimuli, it was being nullified. Not only by the respiratory conditions, but many of the conditions like migraine, lumbago, etc. conditions can also be treated. Benefits of the olfactory route, rapid onset of the action. Administered through the olfactory route can produce fast relief of symptoms compared to the oral administration. Due to the direct absorption into the bloodstream and potential central nervous system effects. Localized action, if we see, direct applications to the nasal passages can target specific symptoms associated with rhinitis and sinus issues, potentially leading to improved efficacy in managing and localized inflammation and irritation. Enhanced patient experience for patients whose experience nausea or vomiting, the olfactory route avoids the need for oral intake, making it more tolerable and accessible. In many of the conditions we have seen, patients are very much, can say, not comfortable for taking the medicines through oral route. Sometimes we can see they develop nausea or vomiting or some in such conditions, the olfactory medicines or administration of homeopathic remedy through olfactory route provides a very beneficial aspect. Inhalation can be less intrusive and more comfortable, particularly in acute situations. Reduced risk of side effects. Bypassing the gastrointestinal tract, it reduces the risk of gastrointestinal side effects associated with oral medications, such as irritation or upset of stomach. Now we're going to see use of the various stalwarts of homeopathy for administering homeopathic medicines to olfactory. The olfactory route for administering homeopathic remedies, while not extensively documented in classical homeopathy, has garnered interest among the contemporary practitioners. Various stalwarts have suggested its potential benefits based on its rapid action direct influence on the central nervous system, and ability to provide localized treatment, particularly for respiratory conditions. Further research and empirical studies are needed to validate these claims and explore the olfactory route's efficacy within the homeopathic practice. Here I will show the study also where we have been using the RCAT score, this Rhinitis control assessment tool, which helps in identification and validation of the administration of homeopathic medicine through olfactory route. The given references and insights highlight a range of perspectives from the early days of homeopathy to modern applications, underscoring the evolving and understanding of how homeopathic remedies can be effectively delivered and utilized. Looking about the first and foremost about and talking about Master Honeyman, in the footnote 1 to aphorism 288 of 5th edition of Organon of Medicine, states that it is especially in the form of vapor by olfaction and inhalation of the medicinal aura that is always emanating from a globule impregnated with a medicinal fluid in a high development of power and placed dry in a small phial, that the homeopathic remedies act most surely and most powerfully. The homeopathic remedies or homeopathic physician allows the patient to hold the open mouth of the phial first in one nostril and in the act of inspiration draw the air out of it into himself, and then, if he wished to give a stronger dose, smell in the same manner with the other nostril, more or less strongly. According to the strength it is intended the dose should be. He then cocks up the phial and replaces it in his pocket case to prevent any misuse of it. And unless he wishes it, he has no occasion for an apothecary's assistance in his practice. So here if we the Master Hangman has showed how we can administer the medicine through olfactory route, taking the impregnated globule with medicinal fluid into a small vial. The homeopathic physician allows the patient to hold the open mouth of the vial first in one nostril. So if we are not taking the globule, we can directly take the medicine also, but it would be the case we are being, misusing the case of infection from one patient to another patient. So it is better to go with the help of these kind of particular method which has been explained by Master Heyman. So this was the method through which we can administer the homeopathic medicine through olfactory route. Next is a case being explained by Master Herring, Dr. Constantine Herring, who was known as the father of homeopathy in America, recognized the olfactory route but used it sparingly. He primarily focused on oral administration but also accepted olfaction as a valid method in sensitive cases. Herring, in his guiding symptoms of Materia Medica, does not frequently mention about the olfactory route but acknowledges it in the relation to highly sensitive patients. In cases where the patient is extremely sensitive to even the smallest oral doses, olfactions or administering the remedy by smelling can be considered. This has been particularly mentioned into the Herring's guiding symptoms. Rationale is Herring recognized that some patients might react intensely to the oral doses, especially in high potencies, and saw the olfactory method as a gentler alternate. Next is being discussed about E.B. Nash, who is known for his clinical focus and concise case presentations. Just like Dr. J.T. Kent, he did not prioritize the olfactory route, he recognized its utility in specific circumstances. In his classic work, that is Leaders in Homeopathic Therapeutics, Nash has references the olfactory route when dealing with the hypersensitive patients. Honeyman's method of administering remedies by olfaction should not be overlooked, especially when dealing with the patients too sensitive to tolerate the smallest oral dose. That is being written into the Leaders in the Homeopathic Therapeutics by E.B. Nash, where Master Nash, Dr. Nash, has not only recognized the utility of olfactory route, also being explained that it is very helpful in the patients who are too sensitive to tolerate the smallest oral dose even. Nash primarily practiced oral doses, but acknowledged that in case of extreme sensitivity, the olfactory route could be considered a viable and effective option also. Pierre Schmidt, who we can say the person who was the first one to use the practical administration of homeopathic uh, medicines with the help of some kind of mist. Smith, a 20th century homeopath and the follower of Hahnemann's teachings, was more open to using the olfactory route. He saw its potential in cases where patients were too sensitive for oral administration or in the situations where there was requirement of the administration of higher potencies. In his writings, Smith refers to the olfactory method as being particularly suited to sensitive patients. He mentions in his commentary on Hellman's work that is administering remedies by olfaction is not only possible but also advisable in cases where patients exhibit extreme sensitivity to the oral doses. The Hidden Treasures of the Last Organon, which was being written by Pierre Smith, he mentions this lines over there in the Hidden Treasures of the Last Organon. Smith used olfaction as an alternative route when he felt that even minimal oral dose could produce adverse effects, and he respected Hahnemann's later shift toward this method in certain cases. So, in my study, I had used RCAT score, that is the Rhinitis Control Assessment Tool, in which the pre-treatment and post-treatment RCT scores are being explained over here, where you can see uh, scores, RCAT pre-treatment scores and RCAT post-treatment scores. The diagrammatic representation of the case based on comparison of the pre-treatment and post-treatment. This is the score which is showing about the efficacy of olfactory route. Whereas in the cases where this orange line, we can say the olfaction was being proved as the more beneficial aspect. Pre-score and post-score helps in identification of improvement in the quality of living also, because this RCT score is based upon the questionnaire, the quality of living questionnaire. If we see about the olfactory route which demonstrated greater efficacy, the first aspect is about the superior improvement with olfactory route. One of the most significant outcome of the study was the greater improvement observed in the patients treated by the olfactory route. If we see about the methodology of the study, the participants, 40 participants were selected on the basis of the random sampling method, where randomly the case numbers from the OPD of the clinic was being selected. And those 40 patients, after being given an informed consent on the patient information sheets, 2020 were divided into the two groups, which were containing 20 in each of the cases. One group was being administered the medicines through olfactory route, whereas the another group was administered the medicines through olfactory route, one through oral route and one through olfactory route. Group A was being administered the medicines through oral route, whereas the group B was being administered the medicines through olfactory route. And then on the basis of the parameters like in how much time the respiratory system is being recovered, in how much time the RCT scores are being improved, in how much time the quality of living of the patient suffering from recurrent allergic rhinitis was also being a parameter. And around these successive parameters, it was being identified with the help of the validation of this RCAT scores. Olfactory route demonstrated a greater efficacy than oral route of medicines administered. How? First, that is superior improvement with the olfactory route. One of the most significant outcomes of the study was the greater improvement observed in the patients treated with the olfactory route compared to the oral route. This finding reinforces the potential advantages of administering homeopathic remedies through olfaction, particularly in conditions affecting the upper respiratory tract. Patients in the olfactory group had a higher average increase in RCT scores, suggesting that enhanced effectiveness in the symptom relief, which we already saw in the previous slide, that the RCT score increased higher in olfactory group than in the oral route. Faster recovery was noted in as a key symptoms such as nasal obstructions, sneezing, and loss of smell, which aligns with the theory that olfactory nerve stimulation may enhance the therapeutic response. The study strongly supports the notion that olfactory administration optimizes remedy action likely through the neurological and immunological pathways, providing stronger and quicker symptom relief than the conventional oral route. Clinical implications fishy or shift towards the olfactory administration. The results suggest that incorporating the olfactory route in homeopathic treatment revolutionized symptom management in rhinitis and upper respiratory tract conditions. When the treatment was going on, when the study was going on at that time also, the group A patients which were taking the medicines through oral route also found that their family members or their friends who were taking the medicines along the group B by olfactory administration were getting benefit very speedier way in very rapid manner. So they were also being of the aspect that we also want to shift towards the olfactory administration of the homeopathic medicines. But as per the guidelines of the study, we cannot being transfer those patients to them. But this result suggests that incorporating the olfactory route in homeopathic treatment really can revolutionize the symptom management, not only in the case of rhinitis, but in the case of many of the medicines or many of the disease conditions also. The whole study was being statistically tested also by PAT test and Cohen's d coefficient test also, where the p-value of the results was very, very less than 0.05, and the large effect size, that is of the Cohen's d, was 3.87. The olfactory route can be considered a clinically superior method of remedy administration in suitable cases. This approach is particularly beneficial for the patients with chronic nasal blockages, reduced absorption via the gastrointestinal tract, or heightened the olfactory sensitivity. Talking about the potential benefits of the olfactory route, we can see the olfactory route of administration involves inhaling the medicinal vapor for potentized remedy. This method is based on the hypothesis that olfactory absorption allows the medicine to bypass the digestive system and interact directly with the olfactory mucosa, nasal receptors, and central nervous system. The olfactory nerve, cranial nerve 1, has direct connection to the brain's limbic system, which regulates the autonomic functions, immune response, and emotional well being. Several potential advantages of the olfactory route include faster onset of the action, that is, direct absorption through the nasal mucosa, which may allow the remedy to act more quickly compared to the oral ingestion. Enhanced bioavailability, avoiding degradation by digestive enzymes. As we all know that our digestive system consists of a variety of enzymes which not only acts on the carbohydrates but it also acts on lipids and proteins. All three biochemical molecules are being acted upon by these enzymes, and they ensure that the medicine reaches to the systemic circulation in an active form if it is being administered through olfactory route. Many a times when the medicine is being administered through oral route, we all know that our saliva also contains one type of enzyme, that is ptyalin, or we can say the salivary amylase. This salivary amylase is again used for digestion of the carbohydrates in our food. And as we all know that our medicine is made up of saccharic, that is the sugar of milk. Sugar, that is also one type of a carbohydrate. So the salivary amylase may digest the medicine which has been administered through this particular aspect. Though it is giving the effects, but it may reduce the effect which is produced by the oral route. So enhanced bioavailability with the help of the olfactory route helps in avoiding the degradation of the homeopathic medicines by the digestive enzymes and ensures that the medicine reaches through the systemic circulation in an active form. Localized effect. If we see our nasal mucosa is being provided with a lot of nervous or neural plexus. The ganglias are present in our nose. If we see far away from some of the place, we can inhale a particular type of the smell which is present around there. Far away from the places, we can also get some of the allergens which directly attack into the nasal mucosa. So, if this nasal mucosa is being directly exposed to the homeopathic medicines, then it would bring about a lot of enhanced efficacy. So, direct exposure to the nasal mucosa may enhance the efficacy in managing nasal symptoms. Neurological stimulations, if we see, the olfactory nerve's connection to the limbic system and hypothalamus play a role in modulating immune and inflammatory responses. So these are the potential benefits of the olfactory route. Now I'm going to share about some of the aspects which I was not able to take into the presentation from our study regarding the various types of results which we have seen into the study. screen visible present? So these are the results which we obtained from the study aspect itself, where we can see that distribution of the cases were done on the basis of the age. So as it was being seen into the prevalence aspect also, people or the adult were being more affected, that is from 20 to 30% on the cases. Pediatric cases were also being seen from about 15 to 20% cases also. This is the distribution where we can see percentage-wise distribution of the cases. Gender-based preponderance. In the study, female preponderance was seen a bit more, 57.5%, affecting almost both the genders equally. Miasmatic aspect, if we see, out of the 40 cases, psychotic aspect was seen in more conditions and more aspect or more preponderant because of the congestion aspect, where accumulation of, we can say, the various blood congestion was which was seen in the nasal mucosa. Here you can see the distribution of the cases according to miasms. Psychosis, 21 cases were seen, and 52.5% was the aspect of the condition. 11 cases were seen in the syphilitic aspect, and 8 cases were seen of the SORA. Potency, in most of the cases, 200 potency was the most suited one, and 30 cm. Going on to the safer aspect, as we are directly administering the medicine through the olfactory route. And distribution of the cases according to the occupation, we can most of the students, farmers and private job practitioners were also being affected. On the type of rhinitis, most of the cases were registered of the allergic rhinitis, but few other cases were being also seen, like atrophic rhinitis, occupational rhinitis, rhinitis, senile rhinitis, idiopathic rhinitis, drug-induced rhinitis, and hormone-induced also. Based on the medicines prescribed, Pulsarilla was being at the top, Silesia, arsenic, here is the remedy drug which we can see. Most of the aspect which I wanted to explain was about the manifestations of the symptomatic aspect. The second aspect was which I was talking about, the comparison of the pre-treatment and post-treatment RCT scores. In the almost all of the cases, the first 20 cases are of oral route and following are of the olfactory route. A major aspect or major change has been seen in the RCAT scores. So these RCAT scores are increasing RCAT scores helps to identify that administration through through the oral and olfactory route. Olfactory is more beneficial. Here we can see oral the scores. Pre-treatment RCT scores was range from 11 to 19 and post-treatment 19 to 30. So in all of these are the variability response, and most of the cases, significant improvement was seen in the cases which were being administered through olfactory outcome. And if we see the statistical analysis, key observations, bad t-test was being applied to it. And if we see to regarding to the subgroup analysis, low improvement, moderate improvement, high improvement, effect size and subgroup analysis, variability in the response, in conclusion was about the mean was increased from 15.85 to 20.3. So this was all about my presentation and the topic. I thank Dr. Noori ma'am and all for organizing this webinar.
Well, thank you, Dr. Nirav, for sharing your valuable knowledge in such a well-structured and informative session. Uh,
Thank you.
I think the way you highlighted the practical decision-making parameters for each mode of administration was especially valuable. Olfactory route offering better results is something our audience should take away. We are confident this
Mm.
webinar offered a valuable evidence-based discussion for our Homeopathy 360 audience. Thank you once again. Audience, if you have any queries with our speaker, you can put it. Uh, Dr. Nirav, can we take some questions?
Yes, ma'am, we can take.
Right. So, Dr. Nagaraj HB is asking if nasal method is effective, then persons working in homeopathic pharmacy will be inhaling the remedies while handling them. How will those persons be affected by inhaling the remedies? Please share your insight on this.
Here comes the knowledge of organon of medicine over here. The medicines, when we administer to whatever is medicine. If we see, if by mistake also, if we administer or one potency by mistakenly to any of the person, particular medicine could have been proven on it, on that particular person. But that is not the case. In that particular aspect, also, we are getting particular results of that remedy, and in many of the cases, aggravating condition also being has been. So when these aggravations and the conditions arise, if if the patient is having particular susceptibility to that drug substance, until and unless that is not going to take place, even though if we n number of the medicines to olfactory route, until and unless the patient or the person is not having susceptibility for them to act upon it, it is not going to act on that person. In the first, if it is in the first, not until that.
Dr. Nirav, your voice is breaking. Can you please check your network? Speaker will join soon. Audience, please wait.
Hello, am I audible, ma'am?
Yes, now you're audible. I think because of
Hello,
network issue, the voice was breaking.
network issue.
Yes, yes. Right. So I hope the question is answered well. Another query by Dr. Vinod Gala is during proving of medicines, if oral route is used, and as you mentioned that salivary and gastric enzymes play important role, then for olfactory route, the proving should be via olfactory route or oral.
Can you please repeat that? There was some breaking.
Sure. If you open on the Q&A,
Hello.
you can see uh, Dr. Vinod Gala is asking, during proving of medicines, if oral route is used, and as you mentioned, the salivary and gastric enzymes play important role, then for olfactory route, the proving should be via that route or oral.
Proving of medicine is being required for the identification of the sign and symptoms of the medicine. The roots provide the efficiency that by which route, if the medicine is being administered,
I think because of network issues, the speaker is being disconnected. Please wait.
the network now stable looks. So, what I was telling about was the efficiency that drug proving is for identification of the sign and symptoms of the remedy, which can be obtained either by administering through olfactory or oral route. The routes are only there for identifying of the efficiency of the medicine, how well the medicine is being registered, how well the medicine acts upon the patient through all both the routes. It is not like that, yes, we may find some of the sign and symptoms intensity somewhat mm, more or less we can see increased or decreased in the cases, but for drug proving, any of the route can be chosen upon.
Right. I think the same answer goes for another question, which is asked by Dr. Shreya. She's asking that we repertorize the case and select the potency accordingly for the oral administration. So the process will remain same for olfactory administration also.
Exactly, the
I
process
think,
remains the same. It is just a route. The difference is in the route administration of the medicine. The results which would be obtained would be better and efficacious with the help of olfactory route. All the process of case taking, repertorization, selection of the remedies remains the same. But how you are going to dispense the medicine through which kind of route, that only is going to change the whole plan of your second follow-up.
right. Dr. Poonam is asking, can you please share how to give olfaction in cases of convulsions and epilepsy?
Master Hahnemann has already explained in our aphorism number 289 that when there is person is having actually olfactory route of administration of medicine is most indicated in the case of the patients having convulsions, where they are the nozzle of the medicine is being kept near the nose and the aroma is itself going on. In our case, we have to take it through a sniff. But in those cases where we can say the medicine when given orally, it may go into the tracheal aspect. So olfactory route, taking upon one of the nose, uh, closing the one of the nostril and taking the aroma of the medicine through bee twisting it at one of the nostril, and the administration of medicine will be taking place.
Right. Dr. Akansha is asking, during homeopathic treatment, can we use homeopathic nasal spray in patients of allergic rhinitis?
I have also designed one homeopathic nasal spray just being influenced from my study. And yes, it is proven very well. And I have also got a grant from the SSIP, that is the government program, where they have been funded for drafting and designing, and it is under process itself because it is going through a clinical verification. As in our thesis, we have taken only 40 patients, which is not enough for giving any of the clinical efficacy. So, with a larger population, larger study population, we are proving that yes, homeopathic nasal sprays can be a forefront runners in the market nowadays.
Excellent. Dr. Nagaraj is asking, in cases of allergic rhinitis, a lot of patients have blocked nostrils, how will the nasal inhalation of remedy preparation will be effective?
For that also, Master Honeyman has already answered of this question. In that particular case, what we have to do, we have to take the medicinal aspect, the medicinal bottle, the nozzle of that medicine, we have to be twixt between our lips, and then we don't have to suck it. We have to just take a like a sniff. How we sniff it from our nose, we have to sniff it from our oral aspect. Though it is being taken through oral route, but it is not, we can say, administering, or it is going through digestive tract. It would be stimulating the nervous plexus which is present in our mouth. This can be done when there is a lot of nasal congestion, and I can give it through reference also, because these were the questions which were being taken up by our ethical committee also for approval of the nasal spray.
Right.
Any further questions?
I think that is it for today. Anything you would like to say, sir? It was a wonderful, informative session. I'm sure the audience is thrilled and, beginning with a wonderful webinar.
Thank you, ma'am. It was my pleasure also to join in the panel of such an vibrant speakers, and especially to deliver my aspect in the platform of Homeopathy 360.
Yes, as we begin the new year, we are honored to have started it with wisdom and experience. Thank you, Dr. Nirav Ganatra, for such a meaningful and enriching session. Thank you, audience, all participants, for being with us today and being so active. Tomorrow, please join us for another such clinically relevant webinar. Goodbye, everyone. Keep learning and keep growing. Once again, thank you, Dr. Ganatra.
Thank you, ma'am.